Thank you. And thanks to everyone who is taking the time to be here with us. We have a great panelist and a subject matter that brings us all together. The situation that we have with COVID-19, issues of equity. We're here to hear and voice concerns. We want to create this space specifically for Black, Indigenous, people of color, otherwise marginalized voices, to kind of raise those voices up and to give them space, and so that concerns can be heard by experts. So we're glad to have people here to speak about their own feelings, but also can come from positions where, again, they can kind of come from positions of, well, speaking of community, we're speaking of equity, so positions of certainly that. Let's get right into it. My name is Lee John Collins Lambert. I'm an educator in Greenfield. I've been in sports education for almost a decade now, but I'm now involved in also racial justice education in Greenfield public school systems. I'm very excited to sort of see this change come about, because it certainly shows me that there is a need for this space to be created and those that are here to hark to that call. So I appreciate that just as a citizen, definitely, and to be able to be here. We also want to thank the Franklin Council of Governments for bringing us all together in the Communities That Care Coalition. With that being said, we'll introduce the panelists, and we'll start with Pastor Reverend Carlos.
Hello, everyone. It's so good to be a part of this panel about what is truly an amazing, important for the world, and important for our country, and important for our area topic, COVID, and the access for everybody to get vaccinated. I am a minister of 3 churches. I am an associate minister at Unity of New York in Manhattan. I am the principal minister at Unity in the City in Brookline, Mass. And for 20 years, I was the pastor of Hope Community Church in Amherst. I retired from that position about 11 or 12 years ago, and passed on the pastorship to my youngest sister, Crystal, and she led the congregation for a number of years, I believe 7 or 8 years, and then she passed on. My other sister, Rhonda, who is married with her last name, but began as Rhonda Anderson. So I was so glad to see one of our panelists is Rhonda Anderson. And she led the community until the end of August of last year. And then she also passed on. So after having retired, after 20 years of being the pastor of Hope Church some years ago, I have returned to being the pastor of that church, as well as still maintaining my association of ministry with the other 2 Unity churches that I mentioned. One thing that I'm most proud of Hope Community Church for having done during my pastorship is that Hope Community Church, through the leadership of my sister Rhonda, became one of the first places where we were talking about white skin privilege and people of color oppression. And it was truly a remarkable work. It began at least 25 years ago. It disbanded after about 10 years of being in effect there, because it is such a difficult work. It's very hard. There were people who were able to begin but not continue with the work. And at some point, we realized that we needed to not have it be one of the principal ministries in the church. But once again, it was a principal ministry in the church for a good number of years, at least 15 years. I'm so grateful for some of the facilitators of that work who have gone out into the greater area and who are doing their work in ending systemic racism and prejudice and bias here in the Amherst area, in the Greenfield area, and all around the country actually right now. So I'm privileged to be a part of this panel And I'm also grateful that as of 3 weeks ago, I have my 2 shots in my body. Thank you for inviting me to be a part of this forum.
Thank you, Reverend. Rhonda Anderson, please. Oh.
Yes, thank you. Kagalagisi ufalaluatak anupaksinaga alak tanaksinaga Rhonda Anderson pangmakpak ano oranga korenimi Shavaktunga Western Massachusetts Commissioner on Indian Affairs Ami, founder and co-director of Okateo Cultural Center Ami, and founder and co-director of Native Youth Empowerment Foundation. So koyanak nalag nagersi. Thank you for listening. Thank you for having me here on the BIPOC COVID-19 Vaccine Town Hall. My name is Rhonda Anderson, and I just greeted you traditionally in my Inupiat language. I'm speaking to you from Coleraine, which is the traditional homelands of the Sokoki Abenaki and Pecumtuck, on the Pecamagon watershed, which is known as the Green River today. Tribes that are still here that call this area their traditional homelands are Sokoki Abenaki in southern Vermont, Nipmuc, and Mohican Stockbridge Munsee. Thank you very much for having me today and lifting Indigenous voices.
Thank you so much. Represent Dr. Wiles. Thank you.
Thank you so much for inviting me to be a part of this panel. I'm really thrilled to be here. Just a little bit of background about myself. I'm an infectious disease physician at South Shore Health in Weymouth, and I've been doing this for about 15 years. And I will tell you that I was not prepared for the pandemic. You know, when it started, we all thought it was going to be like the flu and that it was going to go away. But little did we know that things were not going to be like the flu, and it was going to be a whole life-altering, life-changing experience. I'll say that I have spent numerous hours in gowns and goggles and just fully clad every single day, feels like for 365 days for the year. Really very tough. The hardest part was just seeing patients dying day in, day out with very little to do. I am really excited that, you know, we've gotten to this point and we have vaccines. And vaccines are going to be a major tool that we're going to use to get back to our new normal, whatever that is going to be. I think things are going to be a little different. One of the things that I'm really passionate about is talking to others about vaccines and why it's really important. I myself got the vaccine, got both doses, did very well, and just really happy that I can especially help the communities of color where there's questions, where there's concerns. I understand those concerns. I am a person of color, so I get that. My own family has their concerns. But the key thing is we have to share the information with everyone so that we can be informed about what's going on, because we want our communities to thrive. I am involved with the Massachusetts COVID vaccine advisory group, and we've really done a lot of work with making sure equity has been the focus of all the decisions we make with regards to individuals in the communities of color getting vaccines. I also work with the DPH, with the Health Equity Advisory Group, because again, we want to make sure that the communities of colors or voices are heard. And I make sure that when I'm at those tables, we spread what the challenges are for the communities of color. So this evening, you know, whatever questions you have, I'm here to answer them, give you the medical information that will help you to make informed decisions so you can protect not only yourself, but your family members as well as you get vaccinated.
Thank you, Dr. Wiles. Alberto, please. Thank you.
Good evening, everyone. Thank you so much for having us. It's a really big honor to be here, and it's a pleasure. My name is Alberto Sagastume. I am the Director of Patient Services at the Community Health Center of Franklin County. I have a background in law, public administration, and disability. My heart is near and dear to community health centers because I, growing up, didn't have too much access to primary care or any other services. And growing up, I realized that I missed out on a lot of services. And my passion, what drives me, is how to get these services to traditionally marginalized populations. I'm a native Spanish speaker. My parents are from Guatemala. I grew up in South Florida, and I grew up in a predominantly African-American community. And I witnessed firsthand the struggles that African-Americans went through. And I saw a lot of the diversity in South Florida and all the issues that came along with it. I took advantage of a lot of the positive things too, like the food and the cultures. But the struggles and the issues that marginalized people in our country were facing is what drove me to do the work that I do today. I work in the Community Health Center as the Director of Patient Services. And what that means is I make sure that our patients get the best experience possible. So we take care of grievances, complaints, and we also administer surveys so we can find out what we can do better and where we can improve. Prior to this job, I worked at another community health center for 4 years, and I really liked just doing the greatest good for the greatest number of people that I could do at that time. Getting patients access to healthcare via appointments, via transportation, via just information and resources and outreaching, so they can get all of the resources that are necessary for just for having good healthcare and just being able to live healthy lives. So with that, I'm honored to be here. It's a great pleasure. And I look forward to sharing some of my experiences and our patients' experiences with the vaccine and with this really, really tough pandemic, which, as Dr. Wilds mentioned, I don't think anyone was prepared for, but it's a really big honor and a really big responsibility to be in a position where we can help. Thank you.
Thank you so much. So we're going to move in a question and answer situation, but we also want to address some of the larger questions that are, hanging around sort of the general conversation. And then we have registrants who are here in the Zoom who are going to ask the panelists some questions. So we're going to go through those also. So we're going to move through the myths and sort of the larger questions first, and then we're going to take questions after that. The first question: how could healthcare systems best reach out to BIPOC communities so that people better understand the nature of the vaccine, and so that those who want to be vaccinated can do it in a setting that feels accessible and comfortable? It's a long question. Feel free to unpack part of that, all of that, and I'll certainly repeat anything. Would anyone?
I'll go first.
I would like to volunteer to go
Yes,
first.
I'll go first. I would say that one of the most important things that, a lot of my patients tell me is access. In the communities of color, we don't have a lot of mass vaccination sites. There's a few, but, it's not readily accessible to everyone because of the hours they work, because of just transportation, just so many different factors. And I think that really is something that we need to talk about. How can we make it easier, not difficult, for people to get the vaccine? We're going out, we're telling people get vaccinated, but if it's not something that's easy for you to do, then of course that becomes a bigger problem and pushes people away from trying to get vaccine versus stepping into the place, everything is set up for you. And on that same line, I think the digital divide has been a big challenge, right? People are like, I don't have access to computer, I don't have good Wi-Fi, how can I make an appointment when this is the easiest way? So I think those are some of the challenges which a lot of patients complain, which I think, they're trying to make it easier with phone numbers, but I think on the onset, those should have been thought about a little bit more.
Accessibility is big. Transportation, certainly in a place like Western Mass. I know when we met together as a group, transportation, rural communities, we felt like weren't thought of when a lot of the rollout was happening. So certainly was on a lot of people's minds. Thank you, Doctor. Anyone else right away? I know, Reverend, you were nodding a lot. Anything that you want to add to sort of anything about the accessibility part of this, or any opinions on that first question?
One of the things that is puzzling to me, it's that the past is present. Even some of my relatives in various places in this country have a deep sense of mistrust about vaccinations. They bring history into this current reality, and they're remembering how many people of color were, tricked into getting shots that ended up sterilizing them or making them in other ways at a risk, at a loss. And it's just amazing to me how many people of color I have spoken to, and I'm not just speaking right now about this area of Greenfield, Amherst, Montague. I'm talking about just in all of the fields that I'm in, people of color in New York and in Connecticut and the eastern part of Massachusetts, my relatives in Illinois, my relatives in Kentucky, they are so mistrustful. They think this is a setup for something to get people of color to either die or not be able to procreate. And a lot of them have direct access. They have transportation, they have internet, they just have this mistrust of the system that prevents them from going to get a vaccination. And because they have mistrust, they're not allowing their children to get vaccinated, and they're pretty much spreading the word that we know that in years to come, we will discover that this is just another way that we got taken in. That's very puzzling to me, very puzzling to me. Many of my relatives in Kentucky and in Illinois and various places are complete supporters of Donald Trump. They believe everything he says. They applaud him for everything he ever does. And when he said, don't wear a mask, this is a hoax, it'll be over soon, they just bought it hook, line, and sinker. Their principal reason for following him so closely is their religious take on Barack Obama and others who are in support of people who are in the LGBTQ other communities. They believe that President Obama and now President Biden are in league with Lucifer, and that this country really is going to hell because it is in support of what they believe and interpret as their scripture strict rule against an abomination. And so because they're so against that and so entrenched in that fundamental religionism, they simply are not thinking for themselves and are not getting a vaccine and really do think it's a hoax. Anything that President Trump spoke, they believe. Any way he acted, they found to be true. And that's the mind-blowing thing for me. And because I'm a minister, it's tied in at its core base by religionism, by really thinking that an open embrace of the diverse community, as diverse as it is in all ways, they really truly believe that this country, in other hands, other than President Trump's, is a country that is going to hell. It blows my mind. No matter what I say, it seems to have no effect. The only effect, actually, that it truly has had, that is clear, is to shun me and to go, oh, he is one of them. We won't see him in heaven. He's in league now with Lucifer as well. And they find out I got my shot, and they just shake their heads so sad, thinking, you'll regret it. That's my mind-blowing experience with a number of people of color, Black and brown and red people. They think they're being taken in and that this is fake and that a shot will be nothing that's going to help them, but something that's going to hurt them. And I don't know what to do about that. I don't know if there's anything that anyone can do about it. I'm just so grateful that I'm on a panel with people who are skilled at being able to help people who want the help, to get the help, to support them with information and assistance at every level. This makes me so happy, and it offsets some of my other experience that I've just shared with you. Thank you for your listening.
Thank you, Reverend. I want to open it up also for the question again was a big one. So I would love to hear if Rhonda or Alberto, if you want to weigh in on that. I do also want to segue after this into talking about some of the myths and some of those. So I don't want to lose track with some of what Reverend was just putting down for us, but I do want to open it up for comment again. Rhonda, please.
Yes, thank you, Lee. I do want to echo, white coat syndrome is a really tough barrier right now that I'm dealing with in the Indigenous community. So I do want to acknowledge that. But I also want to sort of touch on, why I'm here, right? And I think that there needs to be a little bit of education on a larger public about our Indigenous issues. And some of that really plays into the white coat syndrome. I'm here, because the CDC had issued COVID-19 mortality data on Native Americans, stating that we're 4 times as likely to contract the virus, but twice as likely to succumb. And Western Massachusetts, we have a population of about 5,000 Native American, Alaska Native residents. And I think we're mostly from Franklin County here, and that shows probably 350, 375 Native Americans. So, that the point is that we're this minority. We've taken this highest toll, right, in lives lost per capita. We're still marginalized, and we've literally been rendered invisible during this pandemic, right? So our COVID numbers weren't even counted in the state until the beginning of the year. Even CNN called Native races as other. So we weren't even, counted nationally, which was, on national news, which was really devastating to be called, oh, it wasn't other, we were something else. That's what we were, something else. And so as Western Mass Commissioner, I wanted to make sure that there was accessibility equity for our Native population in Western Massachusetts. And that was like my biggest question is, how do we ensure this? Because in Western Massachusetts, we're not in a proper service area or district for Indian Health Services. Indian Health Service District is marked as east of 495. And traditionally, like the local tribal governments, like the Mashpee, Wampanoag, and Aquinnah, did not allow access to non-tribal citizens. So that made it really challenging. Now they did open up access for non-tribal citizens to be able to come and get vaccinated. But the fact remains that there's no functioning Indian Health Services or a service entity that I'm aware of at all in Western Massachusetts. So, it became really apparent, like, as the Western Mass Commissioner, I do run Ocotillo Cultural Center, which is the only Native-run organization in Western Massachusetts. And we do serve Native American, Alaska Native, Hawaiian, Pacific Islanders, and Indigenous communities without discrimination. And we have a focus on Indigenous communities here in Massachusetts, right? So we wanted to make sure that we recognized this historical lack of trust within our Indigenous communities of health services. And we want to be able to address those concerns and, hopefully engage in our community and ask our members to commit to testimonials, video recordings, photographs, prepared statements, anything that we can use to support vaccination. We're also trying to have outreach efforts and hopefully, make this a targeted approach that is culturally relevant and educate, right? So educating our population not only on how to prevent and reduce this spread, but how about vaccine efficacy. That's been really challenging, trying to address the questions and concerns and those barriers of accessing vaccines. We just really need to raise that awareness and that education and make it culturally relevant so that it sounds like, you're talking to me and you understand my concerns and my history and my historical and generational trauma with the health industry. So I don't know if I answered your question, but I said a lot.
I think you say so much there, and it's good for us to know. The education piece is huge, and the Indigenous culture it's been understated for too long, to say the very, very least. I want to open it up to Alberto to weigh in, but I want to tailor this discussion a little bit into addressing some of the myths. So Alberto, if you wanted to comment now, I would love to open it up to you. But let's move. Go ahead.
Thank you. And I'll be brief. The BIPOC issues there's a plethora of BIPOC issues, and everything that, has been spoken about here is one piece of the very, very large, complicated puzzle, is the way that I see it. Another piece of the puzzle is, every study, every phase, every trial has been reviewed by the FDA and safety board. So that's a big part of education. Religious beliefs and political beliefs largely steer a lot of people's decisions. That's true. And then there's science. Science also steers a lot of people's decisions. And in this case, it's pointing towards this is looking safe. This is not something that we're messing around with. And as Dr. Wilds mentioned, if we don't follow the guidance and the science, people will die. People are dying. Millions of people have died, and at the expense of following other leaders who are who have other agendas. So I think that the other piece of this really large, complicated puzzle is science. And as part of a community health center, I'm really proud to work in a place where I believe is ahead of its time. Community health centers are a nationwide, actually, it's a worldwide movement. It originated in South Africa, actually, when one of the founders of the first community health center saw their model for delivering care, and it was community-based, and he decided to bring that over here, and here we are 70 years later. So to address two parts of the question, the accessibility part and the comfort part. Accessibility as a community health center, and I hope I don't sound like I'm plugging in Community Health Center of Franklin County, but this is our bread and butter. I mean, our mission, our mission is your health. All are welcome, right? regardless of ability to pay, regardless of what color you are, regardless of where you live, regardless of anything. We're here to help you. Even if you don't have insurance, we're here to help you. Your health, our mission, all are welcome. That's what we stand for. As a rule of thumb, community health centers, that's what they stand for. We offer transportation. So the question is, how can we make it more accessible? How can we offer transportation? If patients don't have a ride to come in, we partner with other organizations in Franklin County and outside of Franklin County to get patients not only to their primary care appointments, not only to their vaccine appointments, even if they're not patients, but also to their specialist appointments in Worcester and Boston. We offer interpreter services. We offer, registration online. And I know that there's an issue with accessibility. Not everyone has access to computer, internet, or even if they do, they're not really savvy on it. But we also think of other ways to make people comfortable. We have a migrant farm worker program where we provide primary care to migrant farm workers in the Western Mass area. And we bring them in. We go into their farms. We do checkups over there. Sometimes we bring them in to see their PCPs in Greenfield. And we've brought in, I want to say over 300 patients, migrant farm worker patients, in for their vaccines, and with interpreters waiting by, with nice, mellow musics, in the background. I'll go down there every now and then, and I'll check in, and in Spanish, I'll ask, our migrant farm workers, how are you feeling? Do you have any hesitancy? Are you concerned about symptoms? Did you take a long time before deciding to get here? And for the most part, the consensus has been, no, I just wanted to finally be able to get the vaccine. That's why it's taken me a little while. I'm not in the age group, or I don't qualify to get the vaccine. So, community health centers, whether you come to Franklin County or any other community health center, that's our bread and butter. Make it accessible, make it comfortable. And then the last thing I'd want to add regarding this topic is there have been, I take lots of complaints, and one complaint I took recently was the provider not communicating with a patient before the provider stuck the patient with a vaccine. And this was something that, I didn't believe, but it was not a person of color. It wasn't, and so there's other complaints and issues around vaccine that all people have concerns about. And, my point is, it's normal to have these concerns, but it's also really, encouraged for everyone to follow the science. So with that, I won't take up any more time. We'll slide on to the next question.
That's what you're here to do. Thank you. And I think it's important to it's feelings are valued. No, you're allowed to feel and I think that's such a great point there to kind of end on. And while we're talking about accessibility, the next part of this is going to be sort of, now that we get to the vaccine itself. And so I want to sort of unpack some myths, and Dr. Wiles, I may end with you, just so you can kind of maybe give us some of the scientific, and Alberto, maybe also with you. So we might start with maybe some opinions on sort of the vaccine, maybe how it's affecting indigenous cultures, or Reverend, how you're seeing it affect some of your parishioners or some of the greater audience there also, but to also give space to those who, and first we'll start with this. Will a vaccine alter my DNA? And I'll ask sort of plainly, Rhonda, are you hearing this sort of myth anywhere? Or Reverend, is this something that maybe is coming up? And certainly I have family in Mississippi and other places, California. So I like you, I think have heard a lot, but is this something that we're hearing about? And if not, we might just end with the doctors and let us know about it.
I'm definitely hearing lots of vaccine hesitancy. I haven't heard the altered DNA yet. I have heard microchips, which has been an interesting one. I've heard people are afraid that they're going to be getting sick. People believe that this is just a standard virus, that the vaccine hasn't been tested enough. that it may give you blood clots or other symptoms that are, that will cause irreparable harm. And I feel that the biggest barrier right now that I'm dealing with is the white coat syndrome, is the mistrust for vaccinations, the believing that there's something that's going to be bad in the formula, or that there hasn't been enough testing. I think those are the biggest questions that I've come up with so far.
Reverend, vaccine affecting DNA is a myth that's out there.
It's amazing. Yeah, I think I've already mentioned the one I've heard the most is that it somehow is an attempt to render men of color impotent and women of color unable to conceive. I've heard people who believe that there are two different formulas in the shots, and one is for people with white skin and probably will promote some protection, and that there's one that is in a vial for people of color that might do the opposite. And when people are on their point of view, one thing I realize more and more is that people really believe what they believe. And when you believe something, you have an investment in it being true. And so you want to spread the word, put out the word that this is a setup, that this is dangerous, or at least very suspect. And so when I have mentioned and brought up, well, it can't be, how could you believe it would be a sterilization or an impotency formula with the countless numbers of white-skinned people getting vaccinated? And that's when I started hearing things like, we believe there are probably two different shots, and that one is for people of color to their disadvantage, and one is for white-skinned people probably for their advantage. And so that's a pretty big myth. And once again, when you believe something, you're invested in it. You're invested in being right. I want to be right. And the saddest thing, one sad thing for me is that there are many people of color that I have talked with and heard from who do not believe people of color should be getting these shots. It's almost like in order to be right, there is something of a hopefulness in their voice that you'll see. Watch what happens to our people. You will see almost like a hopefulness that in order to be right, something has to go wrong. And so it has to be something fishy, something suspect. So it's almost like in order to be right, you're voting for something bad to happen to your own people, so that you can be right, so that you can say, see, I told you. It's the same old thing. That's all I have to share right now about that.
And thank you for that. Thank you for that. And I'm going to want to toss it next to Alberto, and I'd love to hear sort of also more about the myths. You spoke a lot about the migrant population, so anything that way. And there was maybe one more myth that I want to just add to those before it gets to Dr. Wilds, and you can let us know kind of how some of these are wrong, hopefully, in many cases. So, and also the one, will I get COVID from the vaccine itself, is the last one that I'll sort of enter in. And I think a lot of it has been covered by sort of what is. So, Alberto, thank you.
Thank you. You know, when I first heard this myth, and I did hear about it, you know, I thought it was a little tongue in cheek. You know, is that really something that's a real myth? Is that something that people are just making up? And, you know, reflecting back, I don't think that it's, you know, an unfounded, you know, it's not unfounded. Reverend Anderson mentioned there is a history of mistrust with the government, because it hasn't always been as transparent as it is now. It hasn't always been tested. And there has been a history of discrimination in this country, particularly. And so when I'm asked, can a vaccine alter the DNA? I take that as that's a serious question. And the fact that someone is asking that just shows how messed up something was at one point and how we failed to correct it. So my response to that is, the other side to that is, what is the source where we're getting that information? Has there been someone whose DNA was altered and, the pharmaceutical companies, are bearing that? I haven't heard of that. Is it something that we're reading on social media? I mean, that is much more likely to be, distributed in social media, because no one verifies that. No one is held accountable to the information that's on social media, or it's on a different platform, on a really, really small niche platform. And I'm not saying that we should only trust the general media or only trust mainstream media. But we should always look at least to primary sources, medical journals, your primary care physician, your, family, people who've taken the vaccine, people of color who've taken the vaccine. Reverend Anderson shared that he had the vaccine. Dr. Wilds, I'm assuming she had both her vaccines. She's in healthcare. I can't speak for anyone else but myself. I also had the vaccine. And I did some research. I didn't go blindly into it. I didn't really have a choice working in healthcare, although it is optional. Strongly encouraged, but optional. But I did research. I wanted to know what was out there and what were the risks. And I know history. I know that, there's a reason when laws are passed that are affecting or geared towards a racial group, they are scrutinized much more closely than any other law is scrutinized. That means they ask more questions. That means they do more tests. That means they figure out other alternatives before they pass a law that is going to affect racial groups specifically. Why? Because there's a history of mistrust. So, when we go back to the sources, it tells you a little bit more about it might give you more light on the question that you're asking, or the concerns that you have, rather than relying on your own beliefs and kind of spinning down and just thinking about the unverified sources. So with that, our migrant population, I'm very surprised to hear that they have little to no concern. They were just ready to get the vaccine when it was their turn. Some older migrant farm workers did express a concern with their health and immune system, and would that affect them physically, but not because of their race, but because of their age. And a lot of our other patients, there's or the first phase, which was over 75. Those who did show up were willingly taking the vaccine. They were comfortable taking the vaccine. Majority white population, so I can't fail to mention that. But as far as other minorities or other people of color, I think we got to see the whole picture.
Thank you. And I think I certainly heard some solutions in there also about relationships. And I also heard sort of maybe not certainly valuing the person. You don't necessarily have to value the opinion, whatever you might think it might be. It's the person ultimately that should be addressed. So I heard that definitely. So I thought that was a good solutions-oriented thinking. Dr. Wiles, give us your opinion on this. I'm sure you've heard a lot.
Yes, so I think all of the different myths I've heard in one form or another, and I'll try to go through each of them to answer them as best as I can. And if there's anyone who has questions after, I'm happy to work through them. But one thing that Alberto said that I really wanted to stress is the data and the people that analyze the data. And, initially, we all hear about the FDA, we hear about the CDC, we hear about scientists, but there are healthcare workers like myself. I looked at the data. I was like, I need to make sure that this data is good, that, when I tell my patients about the vaccines, that I understand everything, that what they're saying is really true. So I spent time doing that, and I trust the data. And if I trust the data, that means I'm going to take the vaccine. And I did. So having said that, let's just walk through, what the different myths are, knowing that the data is good. And the bottom line is, it comes out that the vaccines are safe, they're effective, and they work well in every race, every color. There's no discrimination. The first one, which I hear very commonly at the hospital and from friends and my colleagues, will it affect my fertility? And the answer to that is absolutely not. It is not going to affect your fertility because it does not get into your cells, which goes to the second point about it altering your DNA. So because it doesn't get into your cells to change your DNA, to change who you are, then there's no need for you to worry about that. Can you imagine them making a vaccine that's going to change your DNA? That would never happen. People would just not allow that to happen. So it does not get into the cells, and that's the important thing. So you're not going to change your hair color because of getting the vaccine, right? Your innate ability is still there because what the vaccine does when you get it, it replicates, it makes spike proteins, and then guess what happened? It helps produce the antibodies, and then it gets destroyed. It's eliminated, it's removed from the body. So there's no way that's going to change your DNA, and it won't affect your fertility. I've had a number of friends who got pregnant during COVID. Their children, their babies are fine, right? I've had people who got pregnant after they got the vaccine and they are doing well. So, that goes to the other question, which I hear commonly, can I get it during pregnancy? Really important to stress. When I see pregnant patients with COVID, they usually are not doing very well because COVID and pregnancy don't go together very well. You end up on a breathing tube. You might end up going into preterm labor. And unfortunately, for some people, there is death. So we really want pregnant women to get the vaccine. And in fact, the CDC and the American College of Obstetrics and Gynecology came out with their stamp of approval for pregnant women to get the vaccine. Next, a myth that I heard was about the 2 different formulas. And I can tell you, that would be too much work for them to have one formula for one group and one for another. We all get the same vaccine. If you're getting Pfizer, the ingredients are same for you regardless of your race. There's no discrimination. In fact, to answer the question, I tell patients, when you go to get your vaccine, if you haven't looked online on the ingredients, because some people say, I don't know what's in it, so I'm not going to take it. It's all there for you to read every single ingredient. There's no hidden ingredient there. It's all up to you to look at it and to check to see whether you're allergic or there's something in there that might just not be something you should be taking. Nothing is hidden. So take a look at the ingredients, no different formulations. The goal is we're trying to save everyone, not one group more than the other. The key is we want everyone to get the vaccine so we can save lives. And I will tell you, devastating impact. My heart breaks every time anyone dies, but particularly in the Black and brown communities, because we see twice as many deaths in that community than we would in the Caucasian community. So really important to get the vaccine. And the other thing that I hear quite commonly, side effects. What are the long-term side effects? And I tell people, yes, the vaccine was done quickly, But make no mistakes about it, even though it was done quickly, they made sure the science was well tested. In particular, for the messenger RNA vaccines, which are the Pfizer and the Moderna, even though it came to the marketplace quickly, they were working on that for about 10 years. They just did not find the particular infection that it was going to be used in. Once we got COVID and they realized that it was going to be successful, they were able, along with a lot of funding from government, private sector, and people working together, we were able to get the vaccine done quickly. And I'm telling you, I'm very happy because as you see, there's many cases of COVID, so many deaths. I mean, it's just heartbreaking. Now we get a chance to really get back to our new normal. So the side effects so far, you know, we do hear about few side effects happening, but you have to look at the totality of the risk versus benefits. And that's really something that's very important. And last thing I'll say, young people saying to me, well, I'm young and healthy, I don't need to get the vaccine. You still need to get the vaccine because you can get COVID, you can get very sick, and again, you can actually die. And if we're trying to get to herd immunity, where we get many people vaccinated so we can protect those who can't, it includes young people. So they really need to get the vaccine as well. I'll stop there.
Thank you, Dr. Wiles. I'm actually going to give you two more that you may possibly be able to comment on. The first one, can we get COVID from the COVID vaccine?
You absolutely cannot get COVID from the COVID vaccine. And the reason that you can't get COVID is because it's not a live virus. It's not, you know, in some vaccines, you can get a modified form of the virus or an activated form. This is so not the case. And to really stress this point is when people get the vaccine, people get side effects, which what we do, we tell everyone, you are going to get some side effects. After the first dose, you'll get some side effects. But after the second dose, your side effects might be a little bit more intense because your immune system is all revved up. But guess what? You are not going to get COVID from the vaccine because this is not a live virus. So there's no possibility that you will get COVID from the vaccine.
Thank you for that. And the last question, and this is something that I'm not really sure any of us can necessarily answer, but can the CDC mandate anyone getting the vaccine?
Well, the CDC will not mandate that right now. Remember, we have got approval for emergency use authorization, which is called an EUA for the vaccine. So there's more steps in order to get full approval. At this point, the CDC will not mandate you to get the vaccine because it's not fully approved. I think they're strongly encouraging people to get the vaccine. Later on, things might change. And just like in some places, they want you to get the flu vaccine. I think we might get there, but I don't want to get ahead of that until we get to that point. But right now, we're really leaving it up to everyone's choice and being informed about the decisions that you make, but it's not mandated at this time.
Okay. Thank you for that. Shift gears just slightly, but we're going to kind of stay in the realm of kind of a little bit of where the myth sort of led us, and some questions that we're going to answer, and then we got some great questions from people who are here with us right now. We're going to dive into those right after. So the first, talk a little bit about the long-term effects about the vaccine versus the long-term effects of COVID, and are these different? And if you are immune compromised. Dr. Wiles, let's start with you.
Yes, so let me start with the long-term effects of the vaccine. I will tell you honestly, transparently, we do not have all the data on the long-term effects of the vaccine. The reason is, in particular with the messenger RNA vaccines, which are the Pfizer and the Covet and the Moderna, these are new vaccines to the market, and so we don't have all the data on the vaccine. The information we have so far is that the vaccine is safe and it's effective. Long term, we really have to wait and see. I'm going to pivot and tell you, however, with COVID itself, most of you have probably heard about post-COVID syndrome, long hauler syndrome. That is something we're gathering data for. But I can tell you, it affects pretty much every organ system in the body. What do I mean by that? If you've had COVID, and it could be very mild, you know, you get COVID and you're fine after the 10 or 14 days. But then months later, you develop these really very bizarre complications. And so much so, people's lives have been altered. What are these complications? Fatigue. You don't even have the energy to take care of yourself. People talk about brain fog. They can't think clearly. They were fully functional. They get the brain fog. Heart, it affects the heart. You get palpitations, heart beating really fast. Some people get some unusual rhythms of the heart that they have to be followed by a cardiologist. Big one, the lung, short of breath all the time. You know, you can't climb up the stairs. You can't do anything without feeling winded. Some people have kidney problems. Some people have blood clots. Some people get rashes, that really unbelievable rashes that we don't know how to really treat them. Some people have visual changes. I mean, every organ system in the body gets affected. So what I say to people, we don't know all the long-term effects from the vaccine, but we are seeing clearly what COVID does to you. And even if you think that it is mild disease you get, years down the road, months down the road, your life could be altered. And we keep learning every day that there's something new that happens as a complication of COVID. So really something that I want to use as a motivator for people to get the vaccine, because we can avoid some of these long-term effects. And one thing I didn't mention, your loss of taste and smell. And I'll share a quick story. I have one of my friends who I call a foodie, knows every restaurant, goes out all the time. And she said to me, you can't imagine how my life has changed because I cannot taste the food. And also I almost burnt my house down because I couldn't smell that something was burning on the stove. Really critical problems that we need to keep in mind.
Thank you, Doctor. I'm going to pivot a moment, allow the doctor to get a glass of water, perhaps. And there are some questions that are coming in, and specifically about the Indigenous community. So I might want to pivot just a little and ask specifically, how well are the communities doing overall in moving through the pandemic, specifically the Black and Indigenous and Asian communities? So I'd like to open it up to Rhonda to this, and you spoke a little bit about this already, but this almost kind of feels like a temp check. How are things going in that world?
Yeah, thank you, Lee. And thank you, Cheryl. I saw that you had put that question in the queue. I'm glad that you're here. The Indigenous community, has initially were given the vaccines as sovereign nations and Indian Health Services. So most Indigenous communities were able to have vaccination policies and plans in place pretty early on. And I would say most nations do have a high vaccination rate. Unfortunately, it is the Indigenous community members that are not living near or on a reservation, and that there is a lot of vaccine hesitancy that I'm seeing right now. I feel like most Native people who wanted their vaccination already had it. As Western Mass Commissioner, I was really grateful to be able to secure codes for the Native American, Alaska Native Indigenous community members and their families to register for vaccination at the Eastfield Mall in Springfield. I figured that was a really great location, and I really feel that DPH officials in this area really moved mountains to make this happen. And I expected to have a lot more people coming forward, which is really depressing. And I'm feeling like we've definitely hit that, that hesitancy wall. So now the push is to change the hearts and minds of our community members.
Thank you. There was another question, and I wanted to actually have Reverend and Alberto maybe speak, because this next question comes and asks specifically, what kinds of stories of hope and relief do you think folks who have been vaccinated have to share that will positively influence those that are hesitant? Alberto, I'll ask you first. You deal with so many communities, and definitely we want to hear the community health center, and we want to promote that as often as possible. Hope, the talk of that, how is that impacting you, or what are your comments on that?
I think the biggest area for hope for our communities or communities of color is their family. People who are getting the vaccine feel safer around their family. Unfortunately, Black people, Indigenous people, people of color, they make less money. We make less money than everyone else. Even if you're in the same professions, you make less money. We don't always have all the same resources to be safe, to order food from Whole Foods, order food to be delivered to your house, whether it's takeout or groceries, fresh groceries. There's not often households who have more than one bathroom. There's limited transportation. People have to rely on public transportation, and it's great to have transportation be free during these times. But it's also concerning to have so many people during these times using the public transit system. So, hope, whenever the vaccine is administered, they can go back home and not worry about, oh my goodness, am I going to get COVID just because I have to go get groceries? Am I going to get COVID just because I have to get to work on a bus? Am I going to get COVID because I'm infected and my family has to share the same restroom? It's a huge relief. And it's very, primal, very basic relief for people. But it goes a long way. They don't have to worry about, is my immunocompromised partner going to be affected more by this? Is my young child who doesn't have her immune system built up yet going to get affected from this? Is my job going to look at me differently because I'm not vaccinated? Are they going to, potentially cut me because I don't have the vaccine? So it's a long list of positive things that people of color are benefiting from when they get the vaccine. But the relief comes from being able to spend more time with their family safely, in my experience, in the community health center experience.
There's a collective nod when you mentioned family. And I think that's the strongest connection, certainly, that hopefully we can all make. And I'm an educator, and today in class with 12-year-olds, we talk about what is family, what is a home, what can we define as that? And sometimes home isn't parents, it could be friends, and so those are connections are huge. Reverend, I'm curious, when we talk about stories and hope, is there anything that that can share or solutions in that way that could sort of bring someone to influence? It's hard to we want to discuss and not debate, right? Any thoughts on sort of stories that work, or any thoughts there?
I know that a lot of what my brother Alberto said is, I could just say ditto to. I know that there is a psychological peace that comes when people of color do get vaccinated. There are two things that are propelling more and more people of color that I am exposed to one-on-one to to choosing to get the vaccine. One of those has been born out of the fact that so many people of color around them in the spiritual community, in their own families and extended families, have contracted COVID. And they have witnessed how ill they have become and the struggle to get back to any manner of health. So sometimes out of a desperate situation can change people's minds. There really is something to this. It's not made up. In one of my spiritual communities, when last I checked in, which was a matter of weeks ago, 18 members of our community had contracted COVID and were going through a very difficult time with it. So then the word gets around and people say, well, maybe there is something to this. Maybe I should get the vaccination. And so I'm noticing that that is an impetus for, not huge swells of people to go get vaccinated, but I'm noticing that more and more, like 5 people here who were committed not to getting the vaccine, 10 people here have changed their minds because they have seen some of the effects that Dr. Wilds was talking about, like with people that they love, like dearly. And so that's promoted. Unfortunately, some change happens out of the ashes, a phoenix of possibility and hope and believing in scientists. It rises out of the ashes of something that had to die. So what does a lot of people have experienced as having had to die was their belief that this was no big thing. Their belief that it was what they had been told by someone they trusted. This is no big deal. This is no big deal. It'll be over in a couple of months. And so they are learning through experience that that is not true. The months, the weeks, the days keep ticking by. More and more people are dying or are on ventilators or who, like the doctor said, can't walk up their stairs anymore, cannot dress themselves anymore, need assistance going to the bathroom. So it's like education, sometimes that cannot come through the mouth of experts, comes through experience, comes through witness. And so they're witnessing. Another thing that I've recently had not large numbers of people, but more numbers of people are just plain over wearing masks. And so they're thinking, even though I have some suspicions about this vaccination and what might be in it, I've got to get out of this mask. And so a handful of people here and there are getting vaccinated with their principal motivation being, I can finally get out of this mask. And the hope for me is that people will access more and more information from individuals like those I'm sharing this space on this panel with, from Dr. Wilds, from my brother Alberto, from my sister Rhonda, my brother Matt Allen, my brother Lee. More of this, I think, can motivate people rather than to be motivated out of just I'm over the mask, or let me watch someone I really, really love get ill before I believe it. I always know that there's hope, or I believe in hope. I believe in the upward travel of the awakening in consciousness of humanity. And I believe that what we're doing today is so important, and what others are doing. I believe that what all of you individuals are doing in your professions and in your personal life are really, really, really making a significant difference. And my hope is that it will continue to blossom, and that it will continue to flourish, that all of the work that all of you are doing is blessed, is funded, and works. But I always live in a consciousness space of hope. Many times the darkest hour is right before the day, as we all know. I truly believe that I possibly would have been more independently active in involvement in different organizations, either by getting personally involved in them or assisting in funding organizations. But this last February 9th, traveling back from church in Boston, I hit black ice, and it was so clear to me that this was the end of my time on earth, that this is the moment. I thought about life on planet Earth and how many difficulties come with it. On February 9th of last year, COVID had not been mentioned. There was no word of it. But I thought about life on planet Earth and some of the challenges with inequity, the challenges with racism, sexism, homophobia, classism, elitism. I thought about how the country appears to be dividing more and more and more. But I gotta tell you, in thinking those were my last moments, all I could really wish is, given all of the challenges on the fourth rock from the sun, the beautiful blue marble we call planet Earth, I really wish I had more time to be here, to experience being a human being, to do whatever I can do to forward justice and liberty and equity and goodness and uplifting for people of all shades, all hues, all races, all denominations, all mindsets. I was stunned to come to, I don't know how long after, to be being cut out of my car, which the only way I could have stayed alive was to have followed the instruction I heard right before impact, which was fall on your right side, pull your legs up into a fetal position, and grab the back of your head. That was the only little spot in the car that was not completely obliterated. I broke my neck, I broke 5 ribs, I broke my collarbone, I broke my jaw in 2 places, I fractured my elbow and my knee, but I lived. They were not hopeful that I would be up on my feet anymore, and for a couple of weeks there was a possibility that I might be rendered paraplegic. I had to make sure not to move my neck. It was up to me. They kept me in the hospital long enough to do their thing. And then it was like, we're discharging you. We need the bed. And you have to make sure no movement of your head happens, because a 1/16 of an inch crack downward, you could easily be paraplegic. And even given the fact that that might not happen, you probably won't be functional for another 3 years. Well, within 5 weeks of within a few weeks of my accident, while I was mending, word came about COVID. And oh, did you hear there's this thing, COVID, going around? Everybody has to stay inside for 2 weeks. And I'm like, good, because I have to stay inside 2 weeks. I thought it was I didn't get the seriousness. Oh, it's good. It'll be good for people to stay in their house for 2 weeks. And I won't feel like the Lone Ranger. And everybody, you know, and then it's like absence makes the heart grow fonder. Once people get back together, it'll be just like a big Christmas party that's happening. And within a few days after hearing about COVID and people staying in their house, my sister Rhonda called to say that she had discovered that she had bladder cancer and that it was probably no big deal because bladder cancer is one that's most people live through if it's caught in time. But every phone call she made was more and more and more and more news we did not want to hear. And so she reported to me twice a week on how the cancer had traveled into her hip bone now, how it was traveling all over, how it was growing. And so from the beginning of March, I watched my sister quickly die while I am trying not to become a paraplegic, and while my mind, which they told me the level of concussion that I received along with the broken neck, they said you may not feel completely coherent and balanced back into yourself for 2 to 3 years. Well, it's been a year and a few months. And that to me is the biggest notice with me. My ribs have healed, my tendon has healed, my elbow, my knee, my neck has healed, but I am living in what they talked about of we don't know how long it will be until you feel like Carlos again, where you feel like your brain is completely lodged in your skull again, and where you think like you think again. So the grieving for my sister, the mending of my body, it really stopped me this year from being more of the activist I was born to be and more of the participator in worthy causes that I was born to be and always have been. It's been a year of a lot of self-care, a whole lot of self-care. It pleased my creator to break my body up in order to put it back together. It pleased my creator to break my heart to a point of shattering. At the last of my family members, there are no more of us. And so that he can put me back together with that. And so as of maybe March of this year, I'm feeling more like me. More like me. And but I have taken the year, I realized as I was invited to be a part of this panel, that this entire year I have simply not given to any of the charities and worthy causes that I have faithfully given to all of the years of my adult life and the new ones that have come along. I have not participated in, somebody has to call me and remind me, you need to rejoin the NAACP Amherst chapter. My dad began that chapter back in 1971. It wasn't in my brain. So I think about you all inviting me to be on this panel, and I think if the invitation had come earlier, I would have had to say no. I'm really glad I said yes, and I really am grateful that this is the time because I really, really, really get excited about people who are taking care of business, people who are doing their work to bring us into a state of appreciation, love, acceptance, where everyone is welcomed at the welcome table. And what we do for one, we do for everyone. And this little this little blue marble. Oh my God, it's got some serious challenges. But take it from a guy who thought it was over. It's so worthwhile being here.
Thank you, Reverend.
Worthwhile being here, forwarding heaven on planet Earth to the best of your ability in whatever way you know, bringing whatever skills you have and discipline you have and devotion you have. I feel like just being with you for this brief amount of time has resurrected something in me. And I just say, I am so grateful. My creator did this just for me.
Thank you, Reverend. We're getting in the chat from the registrants that self-care is a form of activism, and to thank you for the work that you're doing, and blessings to you. So thank you for that, Reverend. I want to get to some medical questions, Doctor, and if they come a little rat-a-tat-tat, I apologize. But we do have some things we want to get to. But first, I want to unpack Johnson & Johnson. There were some comments and questions already about sort of what happened, why is it being different? And I'll start with you, Doctor, but if any other panelists want to chime in after that, but I'd like to start with Doctor, please. Johnson & Johnson.
Yes, so thank you for that question, because I think that's on the minds of everyone as to, why did this happen? There are many different ways I look at this, and I say there is always side effects from drugs. Many of us take medications every day. We have some side effects, some that are known and some that are unknown. The good thing that I like is that with the Johnson & Johnson vaccine, that we were able to pick it up. And I will say it's a very small amount. I know if you are, one of the 15 that end up with this blood clot in your brain, it becomes a big deal. But when you think about 15 individuals out of the 7.8 million that got the vaccine, I think we really have to look at the risk-benefit ratio. And right now, I think that because the number is so small, that we can feel reassured that, one, the system we have in place works. So, we always tell everyone that we're going to be transparent about the data that we have. I think we were transparent. We put things on pause and we said, look, we have found that in a very small group of individuals, we have found this blood clot in the brain, and we want to make sure that we investigate it. So I think that people should not be alarmed, but be really happy that we stopped and we informed people. And now moving forward, we have a warning. And so if someone comes to me and they happen to be a woman in a certain age group, and they have concerns about the vaccines and don't want to take that vaccines, I think we can steer them into another venue, because we have other options of vaccines that we can give them. So for me, my take is the system works, and we should feel reassured that the system works. And so if you are individual that wants to get the Johnson & Johnson vaccine, I would say the odds of you getting that blood clot is really less than 1 in a million. The odds of you getting COVID, getting really sick and dying, especially as a Black or brown individual, is really much higher. So I would say risk-benefit ratio, I'm okay with giving the Johnson & Johnson vaccine.
I just want to say I have the Johnson & Johnson vaccine. I'm okay.
Okay.
And I cried. I thought it was amazing, and I'm grateful for that opportunity, for the one and done.
There is a sense of inequity when it comes up, but I know that, and thank you, Doctor, for saying that and legitimizing it also, Ron, and saying that I got the vaccine, be happy when you do get it. It's an option for those that can't take 2 days off of work. That is seen to be an option that we can use to some people's advantage. Again, all of it comes down to people's personal comfort with it. Your own feelings are valued. So the support systems that Alberto was talking about with the community health centers are sort of trying to help fix some of those inequities, getting people to those appointments that may be farther than what they can afford or what they just physically can do, childcare or otherwise. We are up against the clock, and I unfortunately have to close this session. But the great thing is that this session is not closed. Communities That Care organization is going to make all of our emails available to you, at least getting a hold of the CTC so we can continue this conversation. There were other questions that came in that we weren't able to get to today, but I think we covered a lot. And I think the big part of it was opening this space in the first place, and this being a form of change, a form of activism, and being here and being present is a big part of that. And whether you were watching or being a part of the panel, you're involved in that activism. So I certainly appreciate it. And I appreciate everyone being here, and thank you so much.